You may think that celery is a crunchy vegetable that's just water and some fiber with no nutritional value. But celery has a multitude of health benefits that not only improve your health, but also your life. Here's what can happen to your body if you eat celery every day for a week. Before we begin this video, don't forget to subscribe to our channel for more daily tips like this and turn on notifications so you never miss our new videos. Number 1. Higher levels of hydration. Celery certainly has lots of water, and because it is 95% water, it's a great way to prevent dehydration when you make it a frequent daily snack. There are all sorts of health benefits associated with being hydrated, including increased energy, improved complexion, a healthier immune system, and more. Number 2. It might be an aphrodisiac. Celery contains a high amount of the male pheromones androstenone and androstenol. Some believe that eating celery can increase the perceived level of attractiveness of the men who consume it. Weight loss celery is low in calories, and its fiber content of about 1.5 grams per cup can put a stop to unhealthy cravings. Number 3. Losing weight. Losing weight requires a caloric deficit. This means that you have to burn more calories than you eat every day in order to lose weight. Because celery is so low in calories, it's a great snack alternative to add into any diet. Instead of calorie-heavy chips, substitute them with celery. This way, you can avoid going over your daily calorie limit. Number 4. Has a soothing effect. The magnesium in celery is known to have a relaxing effect on the nervous system. Hippocrates, the father of medicine, once wrote that celery should be used to calm the nerves and for falling asleep. It's also been historically used to treat disorders related to the nervous system. If you tend to be stressed all the time, try adding celery to your diet. Number 5. Boost fertility. It can boost fertility in combination with vitamin E. Celery has been found to increase sperm count. Androstenone, the hormone we discussed earlier, also creates a healthy environment for sperm to mature. Number 6. Stop heartburn and acid reflux. It can stop heartburn and acid reflux. Celery has been recommended as a solution for these conditions because of its low acidity. While more studies need to be done to confirm the effects of celery on heartburn and acid reflux, some people who tried it have reported positive results in the past. Number 7. Anti-inflammatory. If you're at risk for cardiovascular disease and cancer, adding celery to your diet can help you prevent chronic inflammation, a condition that's closely related to such a disease. Number 8. Stomach lining. Studies have found that the antioxidants in celery can reduce gastric ulcers and the risk of gastritis. Number 9. Improves digestion. People who suffer from stomach problems and constipation know the importance of including fiber in their diet. Celery's fiber content can help keep your bowel movements healthy, among other things. Number 10. UTI treatment. In some places around the world, celery is a common and effective way to treat UTIs. Celery has a diuretic effect, so it helps you expel water without losing too much potassium. Number 11. Keep your eyes healthy. Vitamin A, one of the main vitamins found in celery, is known for protecting the cornea. This vitamin is also effective in treating dry eyes. Number 12. Alkaline balance. Balance because of its low acidity, celery can help you stabilize the pH levels in your body and stop acidic buildup. Number 13. Mosquito repellent. Studies have now shown that celery oil extract rubbed on the skin works effectively as a mosquito repellent. If you're one of those people who is prone to mosquito bites, try eating more celery. Now that you know celery is more than water and some fiber, Incorporating it into a healthy diet full of nutrients is a great way to improve your overall health. Be sure to add exercise into your daily lifestyle, too. A healthy body is a healthy mind, and a few simple changes can do wonders in improving your overall life. In addition to celery, be sure to add other vegetables and nutrient-rich foods to your diet. Try avoiding high-calorie, high-fat foods, and too much sugar. Do you like to eat celery? What are some veggies that you like to incorporate into your daily diet? Enjoyed this video? Hit the like button and share with your friends. Subscribe to our channel for more videos like this. Eating almonds every day for a week will do this to your body. Finding a healthy snack can be tricky. It's hard to be healthy when you're consistently on the go. Grabbing something to eat that's quick and easy usually involves a ton of sugar, which can also be problematic if you're trying to lose weight. It turns out almonds could be just the food you're looking for. Keep watching to discover more health benefits of almonds, and while you're here, don't forget to subscribe to our channel for more daily tips like this and turn on notifications, so you never miss our new videos. So you hear it every day, make healthy choices. But sometimes that's easier said than done. Don't worry, your bestie is here to help. When it comes to food that's healthy, nuts and fruits are a pretty great alternative to the old faithful donut or muffin. Before we tell you some awesome health benefits of almonds, you may be surprised to learn they're technically not nuts at all. Get this, they're seeds. Almonds grow on trees, and they are classified as tree nuts. Even though they're seeds, it's a little confusing, but according to the Huffington Post, almonds are seeds of the almond fruit, which kind of looks like a peach, especially because it's fuzzy. When the almond fruit is ripe, we remove the flesh and shell, and then eat the kernel inside. And this is the almond that you know and love. Which, for the sake of simplicity, we'll probably keep calling them nuts. But, you get the idea. If you don't love them already, you will after hearing these great health benefits of almonds. Reason number 1, almonds are full of benefits and are a great addition to your diet whether you're trying to lose weight or not. They're highly nutritious and are full of great stuff like healthy fats, vitamins, and minerals. According to Healthline, the USA is the world's largest producer of almonds. So, they're very popular and are really easy to add to your diet. Just one 28-gram serving of almonds contains 5 grams of fiber, 6 grams of protein, and 14 grams of fat, plus a decent amount of copper, vitamin E, vitamin B2, and phosphorus. That's all packed into a single-ounce serving. Reason number 2, did someone say antioxidants? We just did. You probably hear that word a lot when it comes to your health, and for good reason. That's the stuff that protects against damage to the molecules in your cells, which Mayo Clinic reports can help fight off heart disease, cancer, and other things you don't want happening to your body. The best way to get the most out of the almonds is to eat the ones that still have the brown layer of skin on them. That's where the most powerful antioxidants are, according to PubMed. You can easily buy blanched almonds, the ones without the skins, but if you're trying to be healthy, you'll want the brown almonds with the skins. Fruits and veggies are also a great source of antioxidants, so why not add some variety? Pass the vitamin E, please. We mentioned this a bit earlier, but we need to elaborate because this particular vitamin has some great benefits. Vitamin E is another antioxidant. Remember those? In particular, the family of fat-soluble antioxidants. And almonds are one of the best sources in the world according to nutrition data. Not only that, but several studies cited on PubMed have said that the more vitamin E you have in your diet, the more you lower your rate of heart disease, cancer, and Alzheimer's disease. Reason number 4, almonds are a popular choice for people with diabetes, and it makes sense because these nuts, or seeds, are low in carbs, but high in healthy fats, protein, and fiber. The most important trait of the almond when it comes to diabetes is they're remarkably high in magnesium. This is a mineral that helps control blood sugar, plus over 300 other bodily processes, PubMed reports. The U.S. National Library of Medicine reports several studies have shown people with type 2 diabetes are deficient in magnesium. As well as people without diabetes, also see major reduction in insulin resistance when supplementing with magnesium. All the more reason to stock up on almonds. No more overeating. Almonds are a great choice for those who are struggling with weight loss. Medical News Today reports that almonds are lower in carbohydrates and high in protein and fiber, meaning that you'll feel fuller for longer. No more snacking when you shouldn't be. The more you feel full, the less you'll feel hungry, and that means less calories consumed in a day. However, healthy eating recommends you limit your serving size if you're trying to lose weight. They do help keep you full, but they're also naturally high in calories. Try keeping your snack size to 1 ounce, or about 23 nuts. Almonds can be a great snack if you have a weight loss goal in mind. Reason number 6, almonds can help lower that bad cholesterol. As we get older, cholesterol is something that we should always keep an eye on. Bad cholesterol is a risk factor for heart disease, and adding almonds can lower that risk. But how? Well, bad cholesterol is measured in the body by something called LDL levels. The higher these levels are, the higher the risk for heart disease, and you guessed it, almonds can effectively lower those LDL levels in your blood, according to Healthline. Researchers at the University of Toronto found that a 5-ounce snack of almonds does a better job at lowering these LDL levels than a whole wheat muffin. All it takes is eating 1 or 2 handfuls of almonds per day. Reason number 7, digestive health benefits. Not only do almonds taste good, but they are high in fiber, which gives them prebiotic properties, which is great for your digestive health overall. Prebiotics promote good bacteria in your stomach and will help you maintain a healthy balance. While research is promising, when it comes to prebiotics, more research is needed. You can still maintain a healthy digestive system with a normal healthy diet, but so far it seems adding almonds doesn't hurt. Reason number 8, to cook them or not to cook them? That is the question. You can get almonds in all sorts of ways. Raw, roasted, sliced, candied? You probably guessed it, but unfortunately, candies are not a healthy option and should be avoided if you're trying to stick to a healthy diet. Although they are pretty yummy when added to sweets. Just saying. So which is better? Raw or roasted? Well, that's a tough one. Healthy Eating reports they both pack a high dose of nutrients and minerals. Although raw does seem to have more naturally occurring beneficial fats, which can be lost when you're roasting them. So raw is probably the best way to get the most out of these babies, but there's no reason you can't switch it up and roast them once in a while too. Reason number 9, they can help prevent gallstones. Hopefully you've never had gallstones in your life because they hurt. Gallstones are formed in the gallbladder. The stones are solid particles ranging in size from a grain of sand to a golf ball. They can form when we neglect our healthy diet by eating high-fat, high-cholesterol meals. Step away from the French fries. There's really no cure for gallstones, and in some cases surgery is needed to get rid of them. However, you can stick to a healthy diet and reduce your risk of these pesky things from forming. WH Foods talks about a study done over 20 years and involved over 80,000 women. In this study, they found women who eat 1 ounce of nuts, almonds, peanuts, or peanut butter each week have a 25% lower risk of developing gallstones. Another great reason to grab a handful of almonds for your afternoon pick-me-up. Now that you know all the benefits almonds have to offer, we have some inspiration on how you can incorporate them into your diet. Here's a few quick snack ideas to help you stick to that healthy diet and enjoy all the benefits of almonds. If you're a fan of yogurt, almonds are a great addition. Try chopping some almonds and adding some dried fruit to boost the healthy impact. Sliced almonds can also be added to any veggie sauté or curry for added texture and fiber. If you're someone that's on the go, smoothies are a great breakfast alternative so you don't miss a meal. Adding almond butter to any shake will give your protein count a boost and add some great flavor. Craving something crunchy? Almonds and apple slices are a match made in heaven and will satisfy just as much, if not more, than that unhealthy bag of chips. And that's it. What did you think of our list? Did we miss one of the major benefits of almonds? Which one of our snack ideas did you like the best? Are you someone who's loved almonds all along and have some great go-to snack ideas? Why not share them with the world, so we can all reap the benefits in the comments below. Thanks for watching. Your diet is more than just fuel to keep your body running, it provides the essential building blocks for your cells. Indeed, the saying "you are what you eat" is not merely a cliché. This is particularly true for those suffering from kidney disease. In the US, kidney disease affects about 37 million people, which represents 15% of the adult population. More than 1 in 7 adults have kidney disease, and approximately 90% of them are unaware of their condition. Approximately 80 million American adults, or 1 in 3, are at risk for kidney disease. The possibility of having kidney disease without knowing it can be quite alarming. However, making a few dietary changes and avoiding certain foods can greatly improve kidney protection. Before you swap out the ice cream in your fridge for green vegetables, make sure to subscribe and hit the notification bell so you never miss an update from us. Support healthy care by watching this video to the end. Now, let's dive into the 15 foods you should avoid for healthier and happier kidneys. 1. Peanut butter. Peanut butter on bread may seem like a tasty and healthy choice, but is it truly beneficial? Peanut butter contains high levels of phosphorus, which, in excessive amounts, can be harmful to your body. For those with kidney issues, this is particularly concerning because weakened kidneys cannot effectively remove phosphorus from the blood. This excess phosphorus then draws calcium out of your bones, weakening them and increasing the risk of fractures. It might be wise to moderate your peanut butter consumption. 2. Junk food. While it's hard to resist the occasional craving for pizza, burgers, French fries, or onion rings, indulging in junk food could be detrimental to your health. A recent study has indicated that a diet predominantly consisting of junk food can lead to blood sugar levels comparable to those seen in type 2 diabetes. Such dietary habits can cause long-term damage to your kidneys and potentially trigger diabetic kidney disease. It might be best to cut back on these foods for the sake of your kidney health. 3. Shellfish. Shellfish, including clams, lobsters, crabs, and shrimp, are known for being excellent sources of protein. However, research has uncovered that a toxin called domoic acid, found in shellfish and some fish that consume algae, can damage the kidneys. Alarmingly, even minimal exposure to this toxin can be harmful. If you have kidney disease, it may be wise to avoid shellfish to protect your kidney health and steer clear of your favorite seafood restaurant. 4. Pickled foods. Pickled foods are generally a favorite for many, but they are also loaded with sodium. When your kidneys are compromised, they struggle to eliminate excess sodium and fluid from your body. 5. Eat healthy. This buildup can lead to several issues such as swollen ankles, puffiness, increased blood pressure, shortness of breath, and fluid accumulation around your heart and lungs. Canned soups. Soups are often viewed as a healthy option, but don't be deceived by canned varieties, even those labeled as low sodium. These products tend to be high in potassium, which can be problematic for those with kidney issues. Weak kidneys struggle to remove excess potassium from the blood, leading to a buildup that can cause symptoms such as nausea, weakness, numbness, and a slow pulse. It's important to look beyond the labels and consider the overall nutrient profile when choosing canned soups. 6. Processed foods. It may seem like a good idea to grab those seemingly healthy granola bars or slices of brown bread every day, but if you have kidney disease, you might need to reconsider. Processed foods such as potato chips, cookies, deli meats, bread, and cheese are significant sources of sodium and phosphorus additives, both of which can have damaging effects on the kidneys. While an occasional bag of potato chips is fine, moderation is key to managing your intake of these harmful additives. 7. Red meat. A juicy steak or a succulent rack of lamb might be hard to resist, but excessive consumption of these red meats can be particularly harmful for those with weakened kidneys. These meats are high in protein, and when you consume protein, your body breaks it down into waste products that the kidneys must filter from the blood. Eating more protein than your body requires can place additional strain on your kidneys, potentially causing kidney function to decline at a faster rate. 8. Chocolate. Chocolate is a beloved treat for many, but it also contains unhealthy fats that can heighten the risk of heart attacks or strokes, particularly for individuals with chronic kidney disease, CKD. Those with CKD are already more vulnerable to cardiovascular issues compared to the general population. Navigating the balance between enjoying your favorite foods and adhering to dietary restrictions necessary for your health condition can be challenging. 9. Sugar. Most people are aware of the harmful effects of sugar on various parts of the body, but it may surprise you to learn that sugar does not directly affect the kidneys. However, before you reach for that bag of candy, it's important to understand that sugar contributes to the development of diabetes, a condition that significantly increases the risk of kidney failure and can exacerbate kidney damage if the kidneys are already weakened. This indirect effect makes sugar a critical dietary consideration for kidney health. 10. Soda and cola drinks. There's nothing quite like the refreshing sensation of a cold, fizzy soda on a hot day. However, recent research has shown that consuming at least 2 carbonated beverages daily is linked to increased protein excretion in the urine. A key indicator of kidney dysfunction, regular intake of soda or other carbonated drinks may also lead to hypertension and diabetes, both of which can further impair kidney function, lead to kidney failure, and promote the formation of kidney stones. It might be time to consider replacing those sodas with water or natural, healthy juices. 11. Alcohol. For healthy individuals, the kidneys are constantly active, filtering and managing bodily wastes. However, if you have kidney disease, your kidneys are already working harder than usual to maintain normal function. Consuming alcohol under these conditions can overwhelm your kidneys, preventing them from effectively filtering out dangerous levels of waste from your blood, which can be life-threatening. It's important to avoid binge drinking, especially during events like a college reunion, to protect your kidney health. 12. Milk. Milk is often touted for its health benefits, but it might not be the best choice for your kidneys. Milk contains high levels of phosphorus, potassium, and calcium. When your kidneys are compromised, they struggle to filter out these minerals, leading to their accumulation in your blood. This buildup can have serious, potentially fatal consequences if not managed properly. It might be wise to enjoy that cookie without a glass of milk if you have kidney issues. 13. Avocado. Avocados are a staple in many health-conscious diets, celebrated for their numerous benefits. However, for those with kidney issues, avocados come with a significant caveat due to their high potassium content. When kidneys are not functioning properly, they struggle to remove excess potassium from the body, leading to dangerous levels of buildup. If you have kidney disease, it may be prudent to cut back on avocado toast to keep your potassium levels in check. 14. Salt. Salt is essential for flavoring our meals, but it's primarily composed of sodium, which can be harmful in excess. Consuming too much sodium causes the body to retain fluid, leading to an increase in blood pressure and additional strain on the kidneys. While a pinch of salt can enhance the taste of food, it's important to use it sparingly to avoid overburdening your kidneys. Moderation is key when it comes to salt intake, especially for those with or at risk for kidney issues. 15. Butter. Butter is high in saturated fats, which can raise blood cholesterol levels and increase the risk of heart disease and stroke, especially for those with existing kidney issues or chronic diseases. Instead of completely eliminating butter from your diet, consider using it in moderation and opting for healthier vegetable oils like olive oil or canola oil. This approach not only reduces your intake of saturated fats, but also contributes to a balanced diet and protects your cardiovascular and renal health. A little awareness and knowledge about the ingredients in your food can significantly contribute to healthier and happier kidneys. Was this video an eye-opener for you? Did you realize that some foods, while generally healthy, might be harmful to those with kidney disease? Share your thoughts in the comments section below. If you enjoyed this video, don't forget to hit like, share, and subscribe to my channel. Welcome to Health Bestie on YouTube. A quiet yet formidable health crisis is unfolding globally, affecting millions. Non-alcoholic fatty liver disease, or NAFLD, is a growing concern, particularly prevalent in the United States where it affects between 30 to 40% of the population. This condition, also simply known as fatty liver disease, is linked to significant health complications including liver failure, diabetes, heart attacks, and cancer, impacting 1 in 5 individuals worldwide. NAFLD is primarily associated with dietary factors such as high fructose intake, consumption of vegetable seed oils, and overall excessive caloric consumption. The primary issue at the heart of NAFLD is the excessive accumulation of fat in the liver, so much so that it hampers the liver's ability to function efficiently. A liver is deemed fatty when more than 5% of its composition is fat, turning it into a reservoir for toxins. The insidious aspect of fatty liver is its silent progression. Often, there are no symptoms until the disease is well advanced. When symptoms do manifest, they may include fatigue, pain in the upper right abdomen, itchy skin, and nausea, amongst others. Research indicates that about 20% of non-alcoholic fatty liver disease, NAFLD, cases progress to a more severe stage known as non-alcoholic steatohepatitis, NASH. In this advanced phase, inflammation and fat accumulation begin to damage liver cells seriously, potentially leading to scarring, fibrosis, and ultimately cirrhosis, permanent and debilitating liver damage. Once it transitions to NASH, the liver's functionality is severely compromised. NASH is not only a serious health concern but also life-threatening, increasing the risk of progressing to liver cancer. This type of cancer is particularly aggressive and challenging to treat, highlighting the critical nature of early intervention and management. Fortunately, there's a silver lining. The impacts of NAFLD can often be reversed through targeted dietary and lifestyle modifications. In today's discussion, we will explore a two-stage process designed to naturally detoxify the liver, emphasizing the power of proactive health management to combat this silent epidemic. Stage 1 of detoxifying a fatty liver cleanup. The first critical step in reversing fatty liver involves a comprehensive cleanup of both your diet and environment. This stage is foundational, focusing on eliminating substances that exacerbate fatty liver while implementing healthier lifestyle choices. Dietary changes begin by drastically reducing your intake of refined carbohydrates. This includes cutting out added sugars, especially high fructose corn syrup, HFCS, and avoiding sugary beverages. HFCS, commonly found in many processed foods and drinks, not only prompts significant fat production in the liver but also contributes to a host of other health issues including high blood sugar, increased inflammation, and insulin resistance. These conditions are precursors to more serious complications such as diabetes and obesity. Eliminating refined grains such as bread, pasta, and snacks, as well as desserts, should also be avoided. These foods quickly convert to glucose in the body, overloading the liver and prompting it to convert this excess sugar into fat at an accelerated rate. Visceral fat, as fat continues to build up not just in the liver but also around other organs, it leads to an increase in LDL cholesterol and systemic inflammation. This type of visceral fat is particularly dangerous as it significantly elevates the risk of cardiovascular diseases, including heart attacks. Before we get into stage 2, here's a quick rundown of what your liver does. It removes toxins from the blood, processes nutrients, regulates blood sugar, and produces bile for digestion. Continuing with the detoxification process of a fatty liver, it's crucial to address the role of dietary fats and environmental toxins. In this second phase of the cleanup strategy, further essential adjustments are needed to foster liver health and overall well-being. Eliminate harmful fats. First and foremost, steer clear of vegetable seed oils such as soybean, cottonseed, corn, canola, sunflower, safflower, and peanut oil. These oils are often chemically processed, contributing to inflammation not only in the liver but also throughout the digestive system. Learn linoleic acid, a common component in these oils, is linked to increased liver enzymes and the development of fatty liver. Reduce processed food intake. Processed foods are typically reassembled with unhealthy additives such as added sugars, salts, vegetable oils, fillers, and various chemicals. These components can significantly strain liver function. Choose organic to minimize exposure to pesticides and genetically modified organisms. GMOs opt for organic foods when possible or purchase directly from local farmers. This practice helps reduce the intake of harmful substances that can aggravate liver conditions. Limit alcohol and toxins. Alcohol is a well-known irritant to the liver and reducing its consumption is vital. Additionally, be cautious of the toxins present in water, air, and personal care products. These toxins can overload the liver and facilitate the progression of non-alcoholic fatty liver disease, NAFLD. Engaging in physical activity, regular exercise, and intermittent fasting are effective methods to burn off excess glycogen stored in the liver. When liver glycogen is depleted, it reduces the likelihood of carbohydrates and sugars converting into fat stored in the liver, helping to decrease overall fat accumulation, hydration, and sleep. Finally, maintain adequate hydration and ensure quality sleep. Both are essential for supporting the liver's natural detoxification processes and overall health. Before we dive into stage 2 of our liver detoxification journey, let's first appreciate the crucial roles your liver plays. This vital organ is not only responsible for removing toxins from your blood but also processes nutrients, regulates blood sugar levels, and produces bile, which is essential for digestion. Additionally, the liver synthesizes glutathione, known as the body's master antioxidant. Glutathione plays a key role in combating pollutants, pathogens, and carcinogens that we encounter daily. If you're finding this information helpful, please make sure to like, share, and subscribe. Don't forget to hit the notifications bell so you never miss out on our health insights. Now, moving on to stage 2, which we call reset, we focus on integrating specific foods and supplements that help rejuvenate and restore liver health. This next phase is critical for reinforcing the liver's natural detox capabilities and enhancing its function after the initial cleanup stage. Number 1. Extra fiber and probiotics. Incorporating more fiber and probiotics into your diet is essential for maintaining healthy blood sugar levels and supporting liver health. Fiber, particularly soluble fiber, is a type of complex carbohydrate that does not cause spikes in blood sugar. It aids in keeping you fuller for longer, which helps in managing weight by preventing overeating. Soluble fiber also plays a crucial role in maintaining regular bowel movements, facilitating the rapid elimination of toxins from the body. Soluble fiber works by dissolving in water to form a gel-like substance that nourishes and supports the beneficial bacteria, probiotics, in your gut. This relationship is vital because about 70% of the blood that the liver filters comes from the intestines. Boosting your gut's beneficial bacteria can significantly reduce liver inflammation and decrease the risk of developing fatty liver. Excellent sources of soluble fiber include garlic, chicory root, apples, barley, beans, carrots, citrus fruits, oats, and peas. While most plant foods contain both soluble and insoluble fiber, they typically have higher concentrations of one type. Insoluble fiber, which helps form stool by absorbing fluids and adhering to other materials, can be found in foods like mushrooms, beans, nuts, vegetables, and berries. To increase your intake of probiotics, consider adding fermented foods to your diet, such as sauerkraut, kimchi, kefir, natto, and certain cheeses like aged cheddar and Gouda. These foods help enhance gut health, which in turn supports liver function and overall well-being. Number 2. Cruciferous and sulfur-rich vegetables. Incorporating cruciferous and sulfur-rich vegetables into your diet is a powerhouse strategy for enhancing liver health. These vegetables are celebrated for their ability to boost the liver's detoxification processes and shield it from damage. These include broccoli, Brussels sprouts, cabbage, kale, bok choy, Swiss chard, cauliflower, watercress, turnips, and radishes. A notable compound found in broccoli sprouts, called sulforaphane, has been shown to significantly improve liver function and reduce oxidative stress. Animal studies suggest that sulforaphane can even prevent liver failure by increasing the activity of detoxification enzymes that break down and neutralize harmful substances. Sulfur is crucial for the synthesis of glutathione, a critical antioxidant that the liver needs for effective detoxification. While sulfur can be obtained from animal sources such as beef, poultry, and fish, These foods may also carry residues of animal medications and pesticides, which are best avoided during detox periods. A healthier alternative for obtaining sulfur is through allium vegetables like garlic, onions, shallots, scallions, leeks, and chives. These vegetables not only provide sulfur but also come with a host of benefits including antibacterial, antiviral, antioxidant, anti-inflammatory, and immune-boosting properties. Number 3. Omega-3 fatty acids. Omega-3 fatty acids are crucial for liver health, particularly in combating conditions such as fatty liver and NASH, non-alcoholic steatohepatitis. Research has demonstrated that a diet rich in omega-3s can significantly reduce liver fat and improve liver enzyme levels, aiding in the restoration of liver function. There are 3 essential types of omega-3 fatty acids needed for optimal health: ALA, alpha-linolenic acid, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These fatty acids play a key role in reducing inflammation and supporting cellular health. The best sources of omega-3s, particularly ALA, are found in plant-based foods. These include seaweed and algae varieties such as wakame, nori, kombu, and spirulina. Other excellent sources are chia seeds, hemp seeds, flax seeds, walnuts, edamame, tofu, tempeh, kidney beans, and so on. In olive oil, these foods provide substantial amounts of omega-3s without the need to consume fish. During a detox phase, it's advisable to avoid ocean fish and fish oils, as they might contain pollutants that can strain the liver. Instead, focusing on plant-based sources ensures that you get the necessary fatty acids without additional toxins, supporting your liver in the detoxification process effectively. Number 4. Herbs and supplements. Enhancing liver health can also be significantly supported through the use of specific herbs and supplements, with milk thistle and dandelion roots standing out for their proven benefits. Milk thistle is highly regarded for its liver protective qualities, primarily due to the active compound silymarin. Silymarin acts as a potent antioxidant that not only blocks toxins from entering liver cells but also aids in the detoxification process. It helps to repair liver cells damaged by inflammation or pollution. Artichokes are another rich source of silymarin, providing a food-based option for incorporating this beneficial compound into your diet. Known for its therapeutic properties, dandelion root offers significant benefits for liver function. It has been shown to reduce oxidative stress in the liver, which is crucial for preventing long-term damage. Additionally, dandelion root supports the production of glutathione, a critical antioxidant that the liver needs for detoxification. It also enhances the levels of a specific liver enzyme that improves insulin sensitivity and helps to reduce fat accumulation in the liver. Number 5. Antioxidant-rich foods. Antioxidants play a crucial role in maintaining liver health by neutralizing free radicals, which can damage cells throughout the body, including those in the liver. Incorporating antioxidant-rich foods into your diet is vital for detoxifying the liver and enhancing its functionality. Grapefruits. This citrus fruit is particularly beneficial for the liver due to its high content of naringenin, and naringenin powerful antioxidants known for their ability to combat chronic inflammation and prevent liver scarring. Additionally, grapefruit is an excellent source of quercetin, an antioxidant that has been shown to significantly improve liver inflammation and reduce fat accumulation in the liver. Beyond grapefruits, other dietary sources of quercetin include capers, red onions, and darkly pigmented fruits such as blueberries, grapes, apples, and cherries. Vegetables such as spinach, asparagus, sweet peppers, and broccoli are also good sources of this beneficial antioxidant. Another key antioxidant, resveratrol, has notable liver benefits. It has been shown to reduce fat buildup in the liver, decrease liver fibrosis, protect against oxidative damage, and even possess anti-cancer properties that can target liver cancer cells. Foods rich in resveratrol include grapes, peanuts, cacao, pistachios, blueberries, and cranberries. Number 6. Choline. Choline stands out as a critical nutrient in the fight against fatty liver disease. This essential nutrient is vital for several bodily functions, particularly for its role in liver health. Choline is predominantly found in egg yolks and beef liver, two rich sources that can significantly boost your dietary intake. It plays a crucial role in liver metabolism by aiding in the removal of excess fats from the liver, thereby preventing fat accumulation that can lead to fatty liver disease. It's particularly important for postmenopausal women to ensure they receive adequate choline in their diet. This demographic is often at higher risk for developing fatty liver disease, making choline consumption even more critical. Additionally, controlling overeating habits, such as stress eating, is essential for preventing weight gain and managing diabetes conditions closely linked to fatty liver disease. At least 50% of individuals with diabetes are found to have fatty liver, underscoring the intertwined nature of these metabolic issues. Research indicates that one of the primary pathways through which non-alcoholic fatty liver, NAFL, develops is insulin resistance, the fundamental cause of diabetes. Thus, incorporating choline into your diet while managing your eating behaviors can play a pivotal role in preventing and managing fatty liver disease. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Today, we're going to talk about the number 1 vitamin that controls your mental health. Thinking is a good thing, right? I mean, that's a very positive thing, but overthinking, especially too long, especially when you're trying to go to bed at night, can prevent you from sleeping. When your thoughts dominate your mind and you can't turn it off because you're solving the problems of the world, it becomes a problem, which will also trigger cortisol, which is more stress. Thinking about stress will activate your physical hormones. That will put your body into a stress state. So the question is, are the hormones causing you to do that? Or is it your mind causing the hormones to be activated? Well, I think both can affect each other, but a lot of times people are stuck in this loop thinking and thinking. They're very, very focused on a certain problem or a certain thought that they can't seem to indicate their attention off that one thing. And they end up, looking at different scenarios, different ways of solving something. Speculating, sometimes creating stress that's not even there, which in itself is like the definition of a problem. It's an unresolved thing, and then you get into this paralysis of analysis. Another name for that is you're just stuck in your head. The reason I'm bringing this up is that would be the definition of paralysis anxiety, worry, feeling nervous, and I want to talk about the nutritional imbalance involved in this. There's a major deficiency of a certain nutrient that can cause you to obsessively think and kind of be too stuck in your head. And unfortunately, one of the ways that people address this is that they're usually put on an SSRI. That's a fancy name for a drug that blocks the reabsorption of serotonin. So it basically kind of keeps the serotonin you have in your body so it doesn't go away, but it comes with a big package, and the package has a lot of side effects as well as the downgrading of the receptor for serotonin. So now you're extremely deficient in serotonin where before you were deficient, but now it's like extremely low. And one of the big symptoms of low serotonin is this obsessive solving problems and thinking all the time with the inability to fixate your mind about a certain problem. Of course, with this medication, oh, wow! It affects your other neurotransmitters too, like dopamine. One of the big side effects from SSRIs, it's called SSRI zombie syndrome because you lose your emotions. You feel numb to the world. You start to lose your ability to get any pleasure from sex. Now, if you've been on this medication and you have that side effect, I do have a solution I'm going to talk about, but I just wanted to mention, if you're thinking about taking this medication, you have to be very aware of the terrible side effects that come along with it. So that particular symptom is a very severe deficiency of serotonin and dopamine. And so what Big Pharma has done is they've had a whole bunch of other medications that manipulate other neurotransmitters in certain ways. So, there's several things that decrease serotonin. Drugs, chronic stress, junk food, lack of sun can also create lowered amounts of dopamine. But the big thing that will deplete your dopamine is not having enough vitamin D. Of course, vitamin D comes from the sun. This is why during the winter months, so many people get the blues because of a lack of vitamin D. But now you know why, because vitamin D helps serotonin to work. And so if you're really deficient in vitamin D, you're not only going to get anxiety, it's going to drop down to depression as well. In fact, there's an interesting study that shows that vitamin D will create the exact same effects as a medication for depression, but of course, without the side effects, and what's missing in this mysterious puzzle is having all the microbiome, because if you take an antibiotic and all of a sudden you get depressed now, you know why. Because there are certain microbes that help increase serotonin way more than others. And those microbes are very sensitive to you. Broad-spectrum antibiotics. And a lot of times they'll kill them off and they never come back. And now this person is stuck in a state of stress and they don't even realize they don't connect the dots. Instead they go for the medication and that makes it worse. So there's two things I'm going to highly recommend. You need to get on vitamin D immediately. And I'm not talking about a small amount. I'm talking about at least 10,000 or more of vitamin D3 every single day. But there's something else that's equally as important, making sure that you have the right microbiome, especially the ones that are involved in serotonin, and the microbe that affects serotonin the most out of all the other ones that's virtually non-existent in 96% of the population because of an antibiotic they had long ago is called L-Reuteri. Before you take L-Reuteri, I'm going to recommend that you not take it as a probiotic. I recommend instead you take that microbe from a supplement and you make your own probiotic that will allow you to get the concentrations you're going to need to really fix this problem. Because this microbe not only helps you with anxiety, but it will also increase oxytocin that will greatly help reduce cortisol. And this is the antidote to what we talked about before. If you were on an SSRI and now you're pretty much flatlined, you don't experience pleasure anymore. You can re-establish those feelings consuming it in a yogurt-like form over a period of time. Welcome to my channel, where we'll be discussing the top 10 medications that cause liver damage. The liver plays a crucial role in filtering and processing harmful substances in our bodies. However, certain medications can lead to severe liver damage, and it's important for us to understand them to protect our liver health. In this video, we'll delve into these medications and provide information on the early symptoms of drug-induced liver damage. The last one is the main one, so stay until the end. This will help you recognize and respond promptly to any signs related to your liver health. The 10th medication on our list is the combination of amoxicillin with clavulanate, a widely prescribed antibiotic known for its effectiveness in treating various infections like sinusitis, tonsillitis, pneumonia, and urinary tract infections. Despite its efficacy, there's a significant concern associated with this medication. It has been linked to numerous cases of acute liver injury, a serious condition characterized by sudden liver damage that can have severe consequences if not promptly addressed. Therefore, it's crucial for healthcare professionals to be mindful of this risk when prescribing or clavulanate. Patients should be closely monitored, especially if they're using the medication for prolonged periods or in high doses. They should also be educated about the signs of liver injury and advised to seek immediate medical attention if they experience symptoms such as jaundice, dark urine, extreme fatigue, nausea, vomiting, or abdominal pain, as these may indicate liver problems requiring urgent intervention. The 9th medication known to potentially harm the liver is diclofenac. While all anti-inflammatories, like ibuprofen and naproxen, carry a slight risk of liver damage, it's relatively rare. However, diclofenac is particularly notable for its higher risk compared to other anti-inflammatories when it comes to causing liver injuries. Liver damage from diclofenac can occur weeks or even months after starting to use the medication. Hence, it's crucial to understand that diclofenac not only affects the kidneys but also poses a risk to the liver. Stay vigilant about any symptoms and consult a healthcare professional if you experience any concerns while using this medication amiodarone, also known as Ancarone. This medication stands out for its effectiveness in significantly improving arrhythmias and even clearing 24-hour Holter records. However, it's essential to recognize that amiodarone carries one of the highest indexes of side effects among medications. It can impact various organs, including the thyroid, lungs, skin, and yes, the liver as well. Due to this extensive range of potential side effects, its usage has become more restricted compared to the past, reserved for specific cases where the benefits outweigh the risks. While amiodarone typically doesn't cause acute liver injury, it's important to note that its harmful effects on the liver may take weeks to months to manifest. Healthcare professionals and patients alike should remain vigilant for any signs of liver problems while using this medication and report any concerns promptly to their healthcare provider. The 7th group of medications that can potentially affect your liver are anticonvulsants. Specifically, medications like phenytoin, commercially known as Hydental, and valproic acid, known as Depakote, are noteworthy for their association with liver damage. Hydental has been observed to start causing liver injury immediately after initiation of treatment, while the effects of Depakote may become apparent between 1 and 6 weeks into therapy, underscoring the importance of regular monitoring of liver enzymes. In addition to these, carbamazepine and lamotrigine are also recognized for their potential to cause liver injuries, although such occurrences are much less common. Thus, individuals prescribed these anticonvulsant medications should be vigilant about any signs of liver dysfunction and ensure regular liver function tests to monitor their liver health closely. The 6th medication known to potentially cause liver injury is allopurinol, often prescribed for individuals with elevated uric acid levels or those suffering from gout, especially when dietary modifications alone aren't sufficient to manage the condition. Allopurinol effectively lowers uric acid levels in the body, thereby preventing gout attacks. However, it's crucial to understand that allopurinol can have adverse effects on the liver. Liver injuries associated with allopurinol use can occur rapidly, sometimes within days or weeks after initiating treatment. Hence, patients starting allopurinol therapy should undergo careful monitoring for any signs of liver damage. Regular medical follow-up is essential to promptly detect any issues and adjust the treatment plan as needed. Additionally, patients should promptly report any unusual symptoms that may arise during allopurinol use to their healthcare provider. Despite these risks, it's important to note that allopurinol remains a valuable therapeutic option for many patients with gout or elevated uric acid levels. However, its usage should be managed cautiously, with close attention paid to liver health. The fifth medication of concern is methotrexate, a widely utilized treatment for various conditions including rheumatoid arthritis, psoriatic arthritis, and certain types of cancer. One crucial aspect of methotrexate use is the necessity for continuous monitoring of liver enzymes due to the common occurrence of liver injury associated with this medication. Liver injury induced by methotrexate can span from mild to severe, and in severe cases, may result in significant liver damage if not promptly identified and managed. To mitigate these risks, healthcare providers typically conduct regular liver enzyme tests for patients on methotrexate. These tests serve to promptly detect any signs of liver damage, enabling adjustments in medication or treatment strategies to prevent major complications. Adhering to medical guidelines regarding methotrexate dosage and frequency of use is paramount in minimizing the likelihood of adverse effects, including hepatic ones. In certain scenarios, depending on the patient's health status and response to treatment, healthcare providers may explore alternative therapeutic options to mitigate the risk of liver injury associated with methotrexate. The fourth category of medications that can potentially impact the liver is antifungals. Specifically, fluconazole and itraconazole, commonly employed in the treatment of candidiasis and nail mycosis, are associated with hepatotoxicity in certain susceptible individuals. Given this association, it's crucial for individuals using these medications to treat mycosis to be vigilant about recognizing signs of hepatotoxicity. As mentioned earlier, prompt identification of such symptoms can facilitate timely intervention and management to mitigate the risk of liver damage associated with antifungal therapy. The third group of medications that can impact the liver are antipsychotics, specifically risperidone and quetiapine, marketed under the name Seroquel. These antipsychotic medications are not only utilized in the treatment of psychoses but are also employed for cases of refractory depression, which refers to depressions unresponsive to conventional treatment. Both risperidone and quetiapine carry the potential to cause liver damage, primarily through a process known as drug-induced cholestasis. This condition occurs when there's an interruption or reduction in the flow of bile from the liver, crucial for fat digestion and waste elimination. When medications like risperidone and quetiapine interfere with this process, bile can accumulate in the liver, leading to potential hepatic damage. Therefore, patients undergoing treatment with these medications should undergo careful monitoring for any signs of liver problems to ensure early detection and intervention. The second medication known to potentially affect the liver is methyldopa. Methyldopa is commonly prescribed to manage high blood pressure and is particularly favored for its safety, being the most prescribed medication for pregnant women with hypertension. Despite its overall safety profile, methyldopa has been associated with potential liver damage. As such, its use is not recommended for individuals with pre-existing liver conditions such as fibrosis or cirrhosis. It's important to note that adverse effects on the liver can manifest up to 12 weeks after initiating treatment with methyldopa. Regular monitoring of patients using this medication is crucial to promptly detect any signs of liver impairment. This monitoring helps prevent deterioration and ensures that hypertension treatment does not inadvertently harm liver health. patients with a history of liver diseases should engage in discussions with their healthcare providers to explore safer alternative treatment options. The top drug on the list is paracetamol, which is widely recognized as the leading cause of drug-induced liver failure. Typically, liver injury isn't triggered by the standard dosage, but rather by excessive doses. Unfortunately, due to its widespread availability, some individuals misuse paracetamol, taking more than the recommended amount. For instance, instead of adhering to the appropriate dosage for a headache, they might ingest 3 tablets at once, repeating this overdose pattern. It's crucial to underscore that when taken as directed, paracetamol is safe. Doctors routinely prescribe it to infants to alleviate fever or pain without encountering issues. However, surpassing the recommended dose can be perilous. Shockingly, more than a third of liver failure cases attributed to medications are linked to paracetamol. An overdose of paracetamol can precipitate acute liver failure, which carries a high mortality rate and often necessitates a liver transplant if the organ fails to regenerate itself. Unlike the kidneys, where hemodialysis can sometimes reverse renal failure temporarily, the liver typically requires a transplant once compromised. Moreover, factors like alcohol consumption, genetic predisposition, and concurrent intake of other medications on the list can heighten the risk of liver injury. Liver damage from paracetamol typically initiates within 1-3 days following ingestion, with symptoms manifesting 2-4 days later. Fortunately, an antidote for paracetamol overdose exists: acetylcysteine, also known as Flomucil, which serves as an expectorant and is used for certain cases of OCD and trichotillomania. This antidote proves effective in safeguarding the liver against paracetamol overdose. However, if you've exceeded the recommended dosage, it's imperative to seek immediate medical attention at an emergency room and explain the situation to the doctor, rather than risking the need for a liver transplant. It's essential to recognize that just because a medication isn't listed here doesn't mean it can't cause liver damage. Vigilance and adherence to prescribed dosages are paramount to protecting liver health. The roster of medications carrying hepatotoxic potential is expansive, encompassing antiretrovirals, vitamins like niacin, various antibiotics, supplements, etc., and even herbal teas, a topic explored in a separate video. Given the liver's pivotal role in bodily functions, any malfunction can have far-reaching consequences. Thus, exercising extreme caution when using medications is paramount to prevent drug-induced hepatitis and, in severe instances, fulminant hepatitis. Fulminant hepatitis represents a grave complication affecting a notable fraction of individuals with acute drug-induced hepatitis, often characterized by symptoms like jaundice and yellowing of the skin. Shockingly, among these cases, only approximately 20% survive without the necessity of a liver transplant. This underscores the critical importance of vigilant medication use and prompt medical intervention to safeguard liver health and overall well-being. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. The top 5 vitamins for over 50s. As you reach your 50s and beyond, certain changes begin to take place in your body. For example, you may begin noticing lower energy levels and poor concentration. Aches and pains, especially in the joints, can start to become an issue. You may begin to lose collagen in your skin as it starts to sag and form new wrinkles. And you may also find it more difficult to digest foods properly as you did when you were younger, causing problems like heartburn or constipation. You see, as your body ages, it becomes more difficult for it to absorb nutrients, like vitamin B12 or minerals properly, which can trigger inflammation and advanced aging. Taking medications as you age can also rob the body and deplete key nutrients that it needs to stay strong, healthy, and youthful. Although many people are taking these multivitamin supplements, these usually contain only synthetic vitamins, which are very weak and they don't provide many true health benefits that you want. For this reason, I'm going to share with you 5 vitamins and nutritional supplements to take over the age of 50 that will actually help to improve your health and overall well-being. Number 1 is cod liver oil. One of the best ways to reduce inflammation and strengthen your joints and bones over the age of 50 is by taking 1 to 2 teaspoons of virgin cod liver oil on a daily basis. Ideally, Icelandic or Nordic oil. This golden liquid is loaded with active omega-3 fatty acids, which can ease pain and help to lubricate the joints. It helps to build healthy new brain cells to prevent cognitive decline as you get older. It can improve the structure and the smoothness of the skin to prevent dryness and premature wrinkles. And it also helps to protect the heart by improving circulation, lowering blood pressure, and keeping the heart beating in its regular rhythm. In addition, cod liver oil is also a good natural source of vitamin D, a hormone-like vitamin that keeps your immune system strong against diseases and infections well into old age. So start taking this on a daily basis, and in just 1 week, you'll begin to notice improvements in your overall health and well-being. Supplement number 2 is called digestive enzymes. Now, as people get older, they tend to lose the strength and quality of digestive juices in the stomach and the gut. This causes common digestive problems like acid reflux, heartburn, burping, bloating, constipation, diarrhea, etc. You may find that the foods that you once enjoyed are now starting to cause you problems, and you have to start eating smaller portions and less frequently to deal with it. So in order to overcome these issues, I recommend that you start taking 2 to 3 digestive enzyme capsules before each meal. These naturally help to strengthen your stomach acids. In order to break down foods better and also to absorb more proteins and minerals that your body needs to maintain healthy muscle mass with age so that your muscles don't waste away. Also, when you are choosing a brand, check the ingredients list and make sure that your chosen product contains ox, bile, hydrochloride, and pancreatin for the best effects. Moving on to number 3, which is vitamin C. Vitamin C is one of the most essential antioxidants to protect your cells, DNA, and mitochondria against damage as you get older. This nutrient, however, can only be obtained by eating raw leafy green vegetables, fruits, and herbs. Don't be fooled by the over-the-counter, so-called vitamin C supplements, as these only usually contain ascorbic acid, which makes up for only 5% of the true vitamin C complex. The real vitamin C complex, on the other hand, contains copper, flavonoids, J, K, and P factors, which are all involved with maintaining healthy blood vessels, fighting against inflammation, and boosting your collagen. If you do want to take a supplement, however, you can get it from a whole fruit powder such as camu rose hips, or acerola cherry. Simply place 1 to 2 teaspoons of these powders in a glass of water and drink them, or you can blend them into a super green smoothie every day to boost up your antioxidant network. Natural vitamin C can help to prevent bleeding in your arteries and gums. It can strengthen the collagen fibers throughout your body for healthier skin, teeth, bones, nails, joints, and the meshes around your organs. And it also speeds up your immune cells to help your body heal faster from a virus cold or an infection. The next supplement that we are going to talk about is a mineral complex. If you notice that you are losing the energy, vitality, and vibrance of youth as you reach your 50s, you may be tempted to think that this is a normal part of aging. However, the truth is that it's not. It's actually possible to feel more energized in your 50s than you did in your 20s, regardless of any hormonal changes that may be taking place. Overdependence on coffee, soda, caffeine, and sugar causes the body to become overstimulated, which changes the way energy is made in the cells. So in order to fix this and boost your energy levels naturally without the stimulants, start consuming 1 scoop of a high-quality keto electrolyte powder mixed in a bottle of carbonated water twice per day. When you're looking around, make sure that you choose a brand which contains at least 1,000 milligrams of potassium citrate and 100 milligrams of magnesium citrate, along with the trace mineral complex on the ingredients list. You see, electrolytes and trace minerals help your cells to produce more cellular energy so that you can feel more energized, vibrant, awake, and alert. What's more, these minerals reduce insulin resistance, which allows more fuel to enter your cells, especially within your muscles and your brain. It's recommended to use your minerals in the morning, before and during exercise, as they can help you to build more muscle, and in turn store more protein to keep you strong as you get older. Next up is number 5, the B complex. I highly recommend eating at least 2 to 3 tablespoons of non-fortified nutritional yeast flakes on a daily basis to boost up your B vitamins. B vitamins such as vitamins B1 from the deactivated yeast can help your body adapt to stress, and this normalizes your cortisol levels as you get older. You see, some data shows that over 80% of diseases are stress-related, because stress raises cortisol, which can be destructive to the body in high amounts. Nutritional yeast, B vitamins, exercise, and meditation can all help to lower this destructive cortisol, which in turn can prevent muscle wastage as you age. B vitamins can also help with blood sugar control, building red blood cells, and protecting against flaky skin, especially on the feet and the scalp. So try adding some nutritional yeast to your salads, in your stir-fries, or I like to eat it with kefir or yogurt. And you'll soon begin noticing your emotional stress melting away within less than 5 minutes of eating it. Finally, I'd like to share one additional bonus supplement that you can use periodically to support the health of your gut as you get older. Once or perhaps twice a year, take a 30-day course of probiotics which contain at least 100 billion colony-forming units per day, and make sure on the bottle that there are multiple strains of friendly microbes. Probiotics contain friendly bacteria which colonize your gut, and these can help to repair the mucosal layer and the tight junctions in your large intestine, which often become loose and weak as you pass the age of 50 and beyond. Taking probiotics can help to prevent toxins from leaking into your blood as you age, and they also help your body to break down fiber and absorb more nutrients from your food. Instead of taking a supplement, however, it's best to simply eat probiotics from fermented foods like sauerkraut, kimchi, kefir, and pickles throughout the week. Anti-aging tips. Now that you've learned about some of the best supplements to take after 50, let's explore some other anti-aging lifestyle tips. 1. Boost an anti-aging hormone called IGF-1 by performing high-intensity interval training twice per week, with lots and lots of rest and recovery between training. This helps to improve your appearance by boosting blood flow and collagen in the skin, and also boosts muscle mass. 2. Cut out inflammatory vegetable oils entirely and consume healthier forms of saturated fat like grass-fed butter, tallow, or extra virgin coconut oil. What you may not have known is that your skin is made out of saturated fat, so if you follow a low-fat diet, your body and skin will break down at a rapid rate, causing faster aging and wrinkles. 3. Go to bed 1 hour earlier each night, turning off all of your devices, and give yourself more time to wind down before you go to sleep. Getting a little more sleep can boost the amount of melatonin produced by your brain. That's a powerful antioxidant that protects against cognitive decline as you get older. 4. Focus on keeping your stress levels low by taking long walks outside in the sunshine, watching comedy movies, and listening to some peaceful music. This will lower your cortisol to prevent muscle loss and breathing problems as you age. 5. Keep your body hydrated by drinking at least 1 liter of mineral water each day, making sure to avoid tap water which contains harmful fluorine. And 6. It's also important to keep your insulin levels down to prevent you from gaining too much fat as your metabolism begins to slow down. Do this by eating all of your food for the day in a 6 to 8 hour window, keeping your stomach empty for the remaining hours and drinking only water. In this time, fasting will boost the antioxidant network in your body, and this can help your cells to renew and recycle themselves into new parts. There are also certain foods which contain anti-aging nutrients that you may want to start eating more of on a daily basis. Once again, thank you so much for watching my video today and for your support. Wishing you great health, wealth, and happiness.
Hypertension, or high blood pressure, is commonly known as the silent killer. This is due to the fact that there are often no symptoms associated with it. But if left untreated, its effects can be catastrophic. Medications are often what people turn to in hope of avoiding a fatal outcome. But what if they're not? What the foods you're eating could be causing elevated blood pressure? In this video, we'll unveil the top 8 worst foods for high blood pressure. And you'll also discover why the packaging of your foods and drinks could be causing it to rise. We'll also give you healthy alternatives, so you're empowered to make a change for a healthier life. Before you get the inside scoop of these foods to avoid, make sure to like this video and subscribe to the channel. We've got amazing new content each week. Number 8. Vegetable oils. Vegetable oils were once touted as heart healthy. However, evidence is emerging to suggest that this isn't the case. The issue is that vegetable oils are prone to becoming rancid. During manufacturing, they're exposed to light, oxygen, and heat, which causes them to become oxidized. In particular, it's the polyunsaturated fats, or PUFA for short, that get damaged by oxidation. This causes these fats to no longer function in your body the way that they're meant to. This dysfunction is crucial to understand. Our cells need these fats to work efficiently. A certain type of PUFA, called omega fats, are especially important as they have vital functions. One critical thing they do is help maintain flexible arteries. Having flexible arteries means they can contract and dilate with ease. When they're unable to do this, it can lead to a rise in blood pressure. A study on rats conducted in Kuala Lumpur, Malaysia, found that when these oils were heated and then ingested, the rats had an increase in their blood pressure compared to the rats that were fed fresh oil. Another form of vegetable oils called trans fats or hydrogenated fats has also been found to increase blood pressure. These oils are often found in snack bars, cookies and margarine. Avoiding store-bought versions of these snacks will help you keep away from some trans fats, and switching to extra virgin olive oil and real butter instead of rancid oils will ensure you're giving your body healthy forms of omega fats. Number 7. Alcohol. Although some people argue that alcohol helps relaxation, the findings on alcohol intake and hypertension are not solid. In middle-aged and older adults, binge drinking is associated with an increased risk of heart attacks, stroke, and hypertension. All things we certainly want to avoid. Furthermore, a 2006 review stated that the increase in blood pressure is approximately 1 millimeter of mercury for each 10 grams of alcohol consumed. This is concerning for anyone with even slightly raised blood pressure. But the good news is that this increase was largely reversible in 2 to 4 weeks of abstaining from alcohol. If you're worried about your blood pressure, keeping away from alcohol for a few weeks may lead to a considerable reduction in your readings. However, if you still want to enjoy some alcohol, switch to a glass of red wine a few times a week with a meal. And enjoy its cardioprotective capabilities. Next on our list is an ingredient that can be found in many different foods, from sauces to muesli bars, dried fruits to breakfast cereals. The list could go on, and so could the list of ill effects on your health. Have you guessed it yet? Number 6. Refined or added sugars. I know sugars get a bad rap nowadays, and that's not without good cause, as excess sugar consumption is linked with obesity, diabetes, and inflammatory conditions. All of these are a huge risk factor for heart disease. What makes it worse is that sugar is hidden in so many foods. And when it comes to hypertension, sugar has been shown to increase systolic blood pressure, the top number on a blood pressure reading. This is especially true of sugars that are high in fructose, specifically high fructose corn syrup. So how can we avoid it? Firstly, switching our sugar-laden treats such as cookies, ice cream and cakes is a great place to start. Instead, if you're craving something sweet, opt for a piece of fruit or a few nuts such as almonds or walnuts. Also, check the food labels of breads, crackers, cereals, etc. and see how many grams of sugar they contain per 100 grams. You should aim to avoid anything that has more than 10% sugar content. However, one of the biggest contributors to added sugar is Nexo. Number 5. Soft drinks. I know cracking open a can of cool fizzy sweetness can be just what you feel like on a hot summer's day. But did you know that 1 can of soda contains 9 teaspoons of sugar? That's a whole day's recommended intake of sugar in one foul swoop, or gulp, whatever the case may be. As we've just learned, added sugar, and especially sugars that are high in fat, fructose can have a negative impact on blood pressure. Alarmingly, most soft drinks are sweetened with high fructose corn syrup, so the effect of the sugar may be more pronounced. Not to mention that when drinking soft drinks, there is no fiber or protein in the drink that will slow down the effect of the sugar. A 2016 study done on 5th graders concluded that consumption of soft drinks was related to increased blood pressure, thus suggesting that it doesn't just affect adults. However, the sugar content isn't the only concern with soft drinks. The fact that these drinks are often packaged in plastic bottles or aluminum cans is also worrisome. This is due to the bisphosphate phenol A or BPA that's normally found in these containers. BPA exposure has already been linked to increased risk of heart disease. A Korean study found that when participants drank from a can or plastic bottle, their blood pressure shot up as well as their urine levels of BPA. But if they drank the same drink from a glass container, their blood pressure didn't rise. Neither did the levels of BPA in their urine. Rather than drinking soft drinks, opt for fizzy water and add a twist of lemon or even some frozen berries. If possible, avoid drinking from plastic bottles or cans to eliminate exposure to BPA. The risk associated with products that have BPA in them leads us on to the 4th worst food for high blood pressure. Number 4. Canned foods. Eating canned foods can certainly feel like it makes your life easier and save hours of slaving away over a hot stove. But what if the time it saves you may be adding up on your canned foods not only have the issue of BPA leaching into them, but are extremely high in salt. You're undoubtedly aware that the salt, or sodium chloride, can be dangerous for hypertension. It's estimated that 60% of people with raised blood pressure see full results of further elevation when they increase consumption of sodium. This is called being salt sensitive. Canned foods, specifically soups, have some of the highest levels of sodium of all packaged foods. One single cup serving of chicken noodle soup contains 76% of the recommended daily sodium intake. To avoid raised blood pressure, many people see a huge benefit from reducing intake of table salt. This is why we advise avoiding canned products unless they're low salt and have BPA-free packaging. Next on the list, could your salad be causing elevated blood pressure? Digging into a bowl of salad may seem like a healthier option, right? But could your salad be leading you down the garden path? While the vegetables might be supporting your health, it's what you put on the salad that may be a concoction of blood pressure enemies. Number 3. Salad dressing. If you smother your leafy greens with store-bought dressings, you could be serving up a deadly concoction of rancid vegetable oils. As we've learned, these ingredients are not your friend if you want to prevent hypertension. So what are your options if you want to add some flavor to your salads? Why not try making your own dressing? With half and half extra virgin olive oil and apple cider vinegar. For an extra kick, add some herbs and crushed garlic for a heart-healthy dressing. Number 2. Monosodium glutamate, or MSG for short. MSG is a form of sodium and is responsible for the flavor in many packaged foods. But some people believe there are harmful health side effects associated with it. Studies suggest MSG can cause blood pressure to rise. For example, in China, researchers collected data from 1,227 participants. They assessed their intake of MSG and their blood pressure in 2002, and then 5 years later. They concluded that intake of MSG was associated with higher blood pressure levels, especially in women. In order to avoid MSG, it's important to note that it can also be on food labels as glutamic acid or E620-glutamate or E620 monosodium glutamate or E621 or monopotassium glutamate, E622 calcium glutamate, E623 monoammonium glutamate, E624 magnesium glutamate, E625, or natrium glutamate. So be sure to pay attention to your food labels. Many takeaway foods, particularly Chinese, can have high levels of MSG. So stay away from processed and takeaway foods and enjoy some home-cooked meals. Use herbs and spices as flavoring instead. And now for our number 1 worst food for high blood pressure, cured meats. Right now you may be reminiscing about an indulgent breakfast of bacon and eggs and chowing down on hot dogs at a baseball game. These foods may hit the spot when it comes to satisfying your taste buds, but when it comes to blood pressure, they could be sending it way off the mark. Not only are these meats high, they often contain MSG. The sodium content of one hot dog contains approximately 20% of the recommended daily intake, and that's without the sauce or the bread included. Aside from these problematic additions to the meat, they also contain a type of salt called sodium nitrate. This is used to cure and preserve cold meats. The issue with this ingredient is highlighted in research conducted by scientists in New York who stated that the preservative nitrate could lead to stiff arteries. Stiff arteries lead to higher blood pressure levels as the blood vessels struggle to contract and dilate efficiently, causing the heart to work harder. These scientists performed a cross-sectional analysis of the theory. Third National Health and Nutrition Examination Survey. They concluded there was an interaction between cured meat consumption and hypertension. However, this doesn't mean that meat is off the menu instead of nitrate-free bacon that is low in sodium, and try making your own sausages. So there you have the top 8 worst foods for high blood pressure. We hope this video helps you make some healthy choices when deciding what to eat. Are there any foods on the list that surprised you? Let us know in the comments below, and make sure to stay tuned to the channel to discover more wonderful nutrition and wellness insights.
Top 5 vitamins. People with hypothyroidism should use hypothyroidism, a condition characterized by an underactive thyroid gland that fails to produce or release enough hormones, can lead to a range of troubling symptoms. These include a slowed metabolism, weight gain, heightened sensitivity to cold, hair loss, and numerous other issues. So, what exactly happens in your body when hypothyroidism sets in? As illustrated in the accompanying image, the thyroid gland, shaped like a butterfly, resides in your neck. Just in front of your windpipe, this small gland plays a crucial role in producing hormones that regulate various aspects of your metabolism, including digestion, heart rate, breathing, body temperature, bone health, and much more. When your thyroid malfunctions, either by producing too few hormones or none at all, a host of problems can arise. These include hair thinning, especially at the outer edges of your eyebrows, an intolerance to cold temperatures, and overall weight gain. You may also experience persistent fatigue and feelings of depression. Some individuals may notice the development of deep, vertical ridges on their nails. Left untreated, an underactive thyroid can progress to the formation of nodules and goiters, which manifest as lumps in the neck. In the worst-case scenario, untreated hypothyroidism can lead to life-threatening conditions as your body's internal organs slow down and lose their proper function. But why does the thyroid cease to function correctly? Research indicates that 90% of cases of hypothyroidism are due to Hashimoto's disease, an autoimmune disorder in which the immune system mistakenly attacks healthy thyroid tissue. This autoimmune response often originates from damage to the lining of the gut, allowing undigested proteins like gluten to enter the bloodstream. This triggers inflammation and an overactive immune response that mistakenly targets the thyroid as a threat, resulting in damage and inflammation within the gland itself. Another possible cause of hypothyroidism is inadequate liver function and filtering out toxins or a deficiency of essential nutrients in your diet, such as selenium or iodine. Today, we will delve into 5 vitamins, used broadly to include minerals and nutritional supplements, that can aid in the restoration of your thyroid gland and the re-establishment of a healthy hormone balance. Furthermore, we will explore simple lifestyle adjustments that address the underlying causes of thyroid issues. It is essential to note that when we refer to vitamins, we are encompassing minerals and dietary supplements that can help mend your thyroid gland. To begin, let's address the first item on my list, which is of utmost importance: selenium. Selenium. If you choose to, you can incorporate a daily supplement containing either 200 micrograms of selenomethionine or selenocysteine to enhance the well-being of your thyroid gland. Selenium stands as one of the vital trace minerals required for converting the inactive thyroid hormone T3 into its active form known as T4. In essence, supplementing with selenium can expedite this conversion process, particularly for those with a sluggish thyroid. Research also indicates that selenium intake can decrease thyroid antibodies, thus mitigating the risk of your immune system launching attacks on the thyroid, which can lead to further complications. It's noteworthy that women, in particular, are 8 times more likely to suffer from hypothyroidism compared to men. This heightened risk, especially after pregnancy, often arises due to hormonal imbalances stemming from elevated or reduced estrogen levels. However, selenium rebalancing these hormones by promoting liver health and bolstering the body's antioxidant defense, including the vital glutathione. Now, moving on to the second supplement on my list, bile salts. Surprisingly, many are unaware that a significant 80% of thyroid hormone conversion occurs within the liver rather than the thyroid gland itself. Therefore, simply relying on thyroid medication may not address the root cause, which could originate from liver or gallbladder issues. These issues might include a fatty liver, gallbladder stones, or the accumulation of toxins like mercury in the body, all of which can trigger inflammation and hinder thyroid hormone conversion. If you're interested in improving your liver health, consider supplementing with bile salts. You can take 2 capsules before each meal of the day. This helps to thin out the bile in your liver, facilitating the conversion of T4 to T3, while also aiding in the detoxification of toxins such as mercury, other heavy metals, and harmful chemicals present in your diet that may irritate your thyroid gland. Number 3. Vitamin C complex. As discussed earlier, a staggering 90% of thyroid cases are attributed to Hashimoto's disease, an autoimmune condition where the immune system mistakenly attacks the body due to excessive activity. This often arises from damage to the gut lining caused by the consumption of grain-based foods like bread, pizza, popcorn, cereal, biscuits, cakes, and pasta, which contain the protein gluten. Thank you. Gluten damages the intestinal lining, creating tiny openings that allow toxins and undigested food particles to enter the bloodstream. As the immune system doesn't recognize these foreign substances, it launches attacks throughout the body, leading to inflammation and various health issues. Interestingly, the thyroid tissues share a similar protein structure with gluten, prompting the body to target the thyroid gland as if it were an invading pathogen or virus. This is where vitamin C becomes indispensable. A genuine vitamin C complex includes bioflavonoids that promote collagen production in the body and aid in the healing of the gut lining. For an added boost, you can incorporate 1,000 mg of vitamin C through sources like acerola cherry capsules or powdered fruit blends into your daily regimen. However, Be cautious when selecting vitamin C supplements, as those containing only ascorbic acid, which represents a mere 5% of the complete vitamin C complex, may not be as effective. To truly heal your gut, it's advisable to obtain the entire vitamin C complex from foods like cabbage, sauerkraut, strawberries, bell peppers, and cruciferous vegetables. Number 4. Iodine and zinc. Trace minerals are indispensable nutrients that our bodies require in minute quantities, yet they play a pivotal role in catalyzing thousands of chemical reactions by supporting various enzymes. Previously, we emphasized the importance of selenium in thyroid health, as it aids in neutralizing free radicals produced during thyroid hormone synthesis, thus reducing inflammation and enhancing conversion. In addition to selenium, zinc is another critical mineral that facilitates the synthesis of new thyroid hormones. Iodine, on the other hand, serves as a fundamental component for the production of T3 and T4, the primary thyroid hormones. To incorporate more of these minerals into your diet, consider adding seafood options such as sea kelp, nori, kombu, Irish moss, mussels, clams, crab meat, and oily fish to your meals 2 to 3 times a week. Alternatively, you can opt for liquid trace mineral drops mixed with water or sea kelp capsules to supplement your trace mineral intake. These minerals not only support thyroid function but also contribute to healthy skin, hair, eyes, and nails by aiding in the regulation of cell growth. Number 5. Vitamin D3. Consider a daily intake of 10,000 international units of vitamin D3, along with 100 micrograms of vitamin K2. These vitamins play a crucial role in hormone balance and reducing inflammation in the thyroid gland. Vitamin D, in particular, acts as a hormone that modulates and regulates the immune system, preventing it from mistakenly targeting the thyroid. Research indicates that individuals with hypothyroidism often have insufficient vitamin D levels. Usually due to limited sun exposure or inadequate endogenous production, higher doses of vitamin D3 are frequently employed by functional medicine practitioners to address autoimmune conditions like Hashimoto's. Furthermore, vitamin D enhances liver function, promoting hormonal equilibrium and detoxification, which can mitigate inflammation in the thyroid. Before making any dietary or medication adjustments, it is imperative to consult your doctor regarding the use of these natural remedies. If you suspect you have an underactive thyroid and seek a definitive diagnosis, there are at-home blood tests available for your convenience. Now that we've explored various nutritional supplements for managing hypothyroidism and discussed testing options, let's delve into the underlying causes of this condition. As previously mentioned, excessive consumption of gluten or grain-based foods can harm the gut lining, triggering an autoimmune response in the thyroid. Another contributing factor is the overconsumption of deep-fried foods and inflammatory vegetable oils, which can damage the intestines and liver, leading to inflammation and toxin accumulation within the body. It's worth noting that approximately 80% of thyroid hormone conversion occurs within the liver. Thus, liver disease, especially in individuals who are overweight, can impede thyroid function. Prolonged mental stress, overtraining, or the onset of menopause can elevate cortisol levels excessively, signaling the thyroid to produce fewer hormones. Additionally, insufficient dietary intake of iodine and selenium from wholesome sources may hinder thyroid hormone synthesis. Certain medications, such as statins, diuretics, antibiotics, and blood pressure medications, can induce hormonal changes that weaken thyroid function. Now that you're aware of these factors, let's delve into 6 lifestyle tips aimed at enhancing the well-being and functionality of your thyroid. 1. Eliminate grains, vegetable oils, and gluten from your diet completely. This includes foods like bread, popcorn, canola and soybean oils, corn oils, biscuits, pasta, tortillas, rice, and more. Maintain this dietary adjustment for a minimum of 90 days. You can aid in the restoration of your gut lining by incorporating bone broth, raw garlic, kefir, sauerkraut, and low glycemic berries into your diet. 2. Incorporate anti-inflammatory organic foods such as steamed broccoli, cauliflower, leafy greens, radishes, celery, and Brazil nuts into your meals. Include pasture-raised eggs, wild-caught salmon, sardines, grass-fed beef, organic pork, and shellfish rich in trace minerals. 3. Avoid adopting a low-fat diet, as your body requires specific fats for hormone production. Sources like virgin cod liver oil, pasture-raised egg yolks, and grass-fed butter are excellent providers of retinol, a compound that assists in activating specific thyroid receptors. 4. If you find yourself under significant mental stress and experience tension, consider taking ashwagandha capsules and enjoying lemon balm tea. These natural, ancient adaptogenic herbs can help reduce cortisol levels, alleviate stress, and balance estrogen levels, which could be contributing to hormonal imbalances. 5. Consider incorporating some of the supplements mentioned in today's video. So, particularly those containing bile salts, to enhance the conversion of T3 to T4 within your liver. Seek out supplements that contain bile acid factors, bile salts, ox bile, or TUDCA. These substances can aid in detoxifying the liver and intestines by eliminating toxins and undigested proteins. 6. Last, but not least, adopt timed eating habits. Consume all your daily calories within a 6-hour window, allowing your body 18 hours of fasting. You can still consume the same quantity of calories as you would throughout the day, but confine your eating to this specific time frame. This practice triggers autophagy, which can reduce inflammation, regulate an overactive immune system, and prevent further thyroid complications. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Coffee is the perfect way to kickstart your day. That's because coffee is a pick-me-up and helps those who drink it get through the day. How much do you know about coffee? Coffee is packed with substances that may help safeguard against type 2 diabetes or heart failure. Let's discuss 11 amazing facts about coffee. Number 1. Coffee boosts energy levels. Coffee is high in the stimulant caffeine, which boosts energy levels by improving metabolic rate and fighting fatigue. It also enhances your immune system. The release of adrenaline, the energy hormone for your brain. Caffeine stops the receptors of a neurotransmitter called adenosine. Your nervous system manages adenosine levels. And when you get to a dangerously high level, the brain slows down, making you want to take a nap or stop what you're doing. After drinking coffee, adenosine stops, and the level of the neurotransmitters, like dopamine, in your brain increases, improving your energy performance. A study on cycling participants after having caffeine found that coffee increased time to exhaustion by 12% during a cycling exercise and drastically reduced fatigue levels. Another study had similar results, but was conducted on golf performance. It was found that consuming caffeine before and during a round of golf enhanced performance, reduced feelings of fatigue, and increased subjective energy levels. Number 2. Coffee is a fruit. Coffee is not grown the same way tea plantations are with harvesting the leaves. Coffee comes from cherries, fruit that have seeds and are not part of the plant like the root. Coffee plants generate these fruits so the beans can grow inside them. This can provide two kinds of berries, either red or green. Red berries have a more pleasing aroma and are less acidic, being the go-to preference for lighter roasted coffee. Did you know that a special variety of coffee comes from cat and elephant feces? Combinations of coffee like this are highly sought after worldwide. But those who consume this type of coffee generally do not enjoy coffee from red or green berries. Number 3. Coffee enhances athletic performance. Coffee can be dehydrating, which is one of the main reasons fitness experts recommend avoiding coffee pre- and post-workout. However, a recent study suggests that moderate caffeine intake before exercise improves people's endurance and decreases coffee is a performance enhancer for athletes looking to raise their strength and energy levels. Another study with around 125 older adults noted that drinking coffee was associated with much improved physical performance and faster gait speed, even after researchers had taken the factors like age, fat, and physical activity levels. Number 4. Trying to manage your weight. Caffeine may also help with managing weight, staying fit, and reducing obesity. Coffee supports gut health and alters fat storage, benefiting weight management and heart health. A recent review found that men with lower body fat consume coffee as part of their routine. More research proves this has an identical effect on women. Another study concluded that people who consume more than 1 cup of coffee per day were almost 20% more likely to get their recommended physical activity done than those with less than 1 cup per day. You can add caffeine to your weight loss plan, but make sure you don't add any fatty milk or sugar. Number 5. Coffee can protect you from type 2 diabetes. Type 2 diabetes is a chronic disease that affects how the body reacts to sugar. When blood sugar stays high, it can lead to several health problems. Having coffee may help you reduce the risk of developing type 2 diabetes. A review found that people who consume coffee are at a lower risk of developing type 2 diabetes than people who do not have coffee, which holds true whether the coffee is caffeinated or not. Coffee protects the functionality of the beta cells in the pancreas, which produces the insulin that regulates your blood sugar levels. Coffee also contains magnesium, which benefits your body by breaking down sugar. Number 6. The liver likes coffee. Liver disease is a severe condition that can lead to life-threatening health complications, including cirrhosis. Increasingly, coffee may support liver health and guard against disease. A cup of coffee reduces the risk of dying from chronic liver disease by 15%. If you are an avid coffee drinker, then you may be pleased to know that drinking 4 cups per day lowers the risk of dying from liver disease by around 70%. A study found that drinking more than 2 cups of coffee daily lowers the risk of liver cancer and liver scarring if you live with liver disease. Coffee also decreases liver stiffness, which is linked to the formation of scar tissue. Number 7. Coffee lowers the risk of depression. Some studies have shown that drinking coffee lowers your risk of depression and helps reduce symptoms. Every cup of coffee you consume daily reduces the risk of depression by 8%. One study showed more than 200,000 people drinking coffee were associated with a lower risk of death by suicide. Another study noted that having at least 4 cups of coffee was linked to a significantly lower risk of depression than people who drink just 1 cup daily. Number 8. Your skin also benefits from drinking coffee. Coffee beans contain polyphenol, like chlorogenic acids, called CGA, that may have antimicrobial and anti-inflammatory effects, which can protect you from photoaging. You can apply liquid coffee on your skin, or as a scrub made from the grounds. This can help you with skin problems like psoriasis, eczema, and acne. Just make sure you cool the coffee before using. Number 9. Coffee supports the heart. Coffee can help improve your overall heart health. Drinking 3 to 5 cups of coffee in a day shields you against heart disease, improves overall heart health, and reduces the risk of death by cardiovascular complications. One review showed that drinking close to 4 cups of coffee daily decreases the risk of stroke by 21%. Another study of nearly 21,000 people also found that high coffee intake dramatically decreases the risk of heart failure. Number 10. There's more to coffee in the brain than just improving concentration. Coffee can shield you against Alzheimer's disease, a progressive brain disorder that affects your thinking power and leads to memory loss. Sadly, there is no cure at the moment, but early diagnosis and treatment can definitely slow its progression. A review of studies found that the more coffee you consume, the lower your risk of developing Alzheimer's disease. Number 11. Reduces the risk of Parkinson's disease. Parkinson's disease is also a progressive neurological condition that leads to a struggle with balance and movement. Like Alzheimer's, there is currently no cure for it, but treatments exist to slow down the progression. If you are a regular coffee drinker, then you are at a significantly lower risk of developing Parkinson's disease, and coffee may also slow disease progression. Additionally, limited coffee consumption could lower the risk of dementia and cognitive decline. All these facts do not mean you should readily increase the amount of coffee you consume. For some, coffee can cause irritability, anxiety, or nervousness in high doses. It can also affect sleep quality and cause insomnia. If you have hypertension, coffee can raise your blood pressure. Avoid coffee if you are pregnant or breastfeeding. So how much coffee is considered healthy? And how much is too much? 2 to 3 medium-sized cups per day are okay, if they are without milk, cream, and sugar. Caffeine affects everyone differently. If you start experiencing any adverse side effects, consider cutting your coffee intake accordingly. It is essential to understand that even the most rigorous scientific studies are subjective. So, by all means, enjoy your morning beverage, but interpret these facts with caution. How do you take your coffee in the morning? Let us know in the comments